Well, thanks, Casey. Well, so many people deal with this. Out driving, they get rear-ended or in some kind of car accident, and you think, oh, do I have whiplash? Well, we have some experts here to talk about that. So we have Larry Ziegler, a chiropractic physician, and we have Jeff Metler, an attorney.
Yes.
And so many families are faced with this. So what's the first thing we need to know?
When you're dealing with accidents, time matters. The sooner you get into professionals, whether it's a chiropractor or the attorney, the easier the process is going to be, and you can take a lot of that stress off of you that a lot of people are dealing with because they've never been through this. They don't know what the next step is.
Yeah, but there are tools to help us out. All right, and so talk about children and car accidents.
So children are a specific challenge for us sometimes because often if they're too young they can't tell us where they hurt or whether they're having any trouble. And even kids that are a little bit older, sometimes we don't have the feedback that I would necessarily get from an adult or someone else.
Right.
So they're often overlooked and not even treated. But they're also prone to the same ligamentous injuries or soft tissue kind of injuries that everyone else is. So I tell parents, watch for changes in behavior after a car accident. If we're crying more or not eating right or not sleeping well or there are differences in their normal routine, that's when you want to make sure and get that child checked out. See your pediatrician or your chiropractor who specializes in that type of care and make sure that they get some attention.
And Jeff, it's a big deal for insurance reasons too.
It is. Insurance companies are great on one hand, they're terrible on the other. They are a business, and if they don't understand what you're going through or the information is conveyed improperly to them, you're going to see that they're not your friend. And it's not that they're trying to be mean to you, they're a business. And so that's how having good professionals working with you walks you through the process, takes that stress off, but at the same time allows the insurance companies to understand, hey, there is something that they're dealing with. Let's get them taken care of.
Right. And what are the biggest mistakes that people make when it comes to, post-accident?
I'm going to get better. Guys think that, girls think that, whether it's moms, husbands. One of the things that really hurts a case or hurts somebody getting better is waiting too long.
Yeah, and I can see this. You say men are just like really guilty of this, but I can see, if I got in an accident just in a little pain, I'd probably think like, oh, I'm sure it'll be fine in a few days, but that's the wrong approach.
Well, you'll see that the injuries manifest immediately to typically 3 to 4 days later, but even up to 6 weeks later. And so getting in early, you're going to get better sooner, but at the same time, you're not leaving the insurance companies wondering, are they just trying to make something up?
Right.
Schedules are busy.
Yeah, that's true, yeah.
So
get in soon.
Yeah, and what do you see from the medical side that way?
Definitely, there are different time frames, different areas where it's easier to diagnose or better to diagnose earlier or later, and it's better to be in with the physician who can make the decisions on when to run certain diagnostic tests like an MRI at their most effective times to give you the best possible chance for a good diagnosis.
Right. It's better to err on the side of caution than just to put
typically
it aside.
We're dealing with, well, like Dr. Shelton's book, Whiplash, hidden soft tissue injuries is the key there.
Right.
The ligaments that get torn and other muscle damage, we can't see that. And we can't relate to it as well if we can't see it. So you really do have to do the right testing and take the right steps to make sure that you identify the injury.
All right, so here is your address, your phone number, and this is the Whiplash Group. So if you have any questions or you think that you might be suffering from whiplash, give that number a call. Gentlemen, thanks, both of you, so much for coming in.
Thanks for having us.
All right, stay with us. We'll be right back.